coming. We're still waiting for a few to join us, but it looks like it's taking a while, so we're going to start without them. There are other people waiting for us online, so we want to also keep them engaged. So we will be starting shortly, and then as the others arrive, they join the conversation where they are or where we are. So thank you for your patience. We'll be starting shortly. Good afternoon, or is it good late afternoon or evening? And welcome to the Debate House and to the final session in our three-part discussion on cervical cancer. I'm Nia Krofi Smatabe. I'm glad you could join us. Thank you all. Today's event, as the two previous events, is in partnership with Quality Insurance PLC, or QIC. QIC has various insurance products, including general, motor, and home insurance, as well as marine and travel insurance. And since today is International Women's Day, let me also take the opportunity to remind the ladies in our midst that QIC has a Go Girl policy. It's a comprehensive motor insurance policy specifically designed for women, with a wide range of benefits, including a free courtesy car when the policyholder's vehicle is not available, free vehicle screening, free vehicle servicing. Pardon me, we are talking about cervical cancer screening, so I got carried away a little bit, and the facilitation of a 2-year mandatory driver's license renewal at the DVLA's Prestige Centers. Now, over the past month, we here at the Debate House, in partnership with QIC, we've been exploring ways to increase awareness about cervical cancer screening. Unlike some of the cancers you might be more familiar with, cervical cancer is the most preventable of them all, yet due to a number of factors we've identified over the course of our discussions, particularly the lack of screening, the disease is estimated to claim over 1,000 lives in Ghana each year. It's the second most common cancer after breast cancer in Ghana and the fourth most common globally. During our first session, which was an expert roundtable discussion, we considered the question, if screening for cervical cancer is cheaper than treatment, why do health systems wait? Last week, which was the second session, our topic for debate was, should men be held accountable in the fight against cervical cancer? Tonight, or today, we turn our attention to our customs, traditions, and faith. We'll be considering culture versus science when faith delays life-saving screening, and ask if faith institutions are doing enough or doing harm to women's reproductive health. Our focus is to understand the seeming tension between faith or religion, if you would, cultural beliefs or norms, and science in our society. Why, for instance, do these forces appear to be at odds with each other? Are they truly in opposition, or are we as religious and cultural adherents misinterpreting the relationship that exists between these forces? And why should preventive screening, for instance, equate to weakened faith in the power of the divine to heal? So these are some of the areas we'll be considering. On the panel today with us is, to my immediate left, the Reverend Dr. Emmanuel Chiromating Amwa. He's the Associate Minister of the Presbyterian Church of Ghana, Parousia Congregation. Reverend, thank you for joining us. Next to Reverend is Dr. Mrs. Nita Asamoah Menu Jima. She's a specialist obstetrician gynecologist at the Kolebu Teaching Hospital, and she's also the host of the Facebook series Time with Dr. Nita. So if she looks familiar, that's probably where you know her from. And she's been with us all 3 sessions, so thank you very much for joining us again, Doc. And next to Doc is the Imam Abbas Abdul Karim Umar, the Deputy Imam at the Ghana Police Mosque in Cantonment. Imam, thank you for joining us. And also, let me just acknowledge the presence here today. We are especially invited guest from the Federation of Ghana Medical Students. Thank you, guys, for joining us today. As the future practitioners who will be sitting here someday. We are glad you could make time to join us today. And I hope that we leave here today with encouraged to pursue a preventive approach to cervical cancer, which is, of course, the most preventable of all. And also, before we leave, we here at the Debate House are considering setting up a fund to support the screening of cervical cancer. So we will like to pick your brains on some ideas how to go about the fund. So thank you all. So I guess we can start the conversation now. And I'll come to you, Doc, as I've done severally over the past. Oh, okay, we have two docs. So Dr. Nita, I have to specify. I'll come to you. Cervical cancer symptoms, as we know, takes years to surface. So I want to call it like it's a creepy crawler of sort. So we want to start this conversation by looking at, for instance, why it takes so long to surface, and why early treatment is important.
Okay, so I would start by saying, or I would start by reiterating that cervical cancer is a cancer of the cervix. And this is caused by a virus called human papilloma virus. As with any infection, once you get the infection, we call something an incubation period. And that is a period from the time you were infected up until the time the disease shows itself. So because the HPV or HP virus has a very long incubation period, it takes a very long time before the symptoms show. And like any infection, when you get the HPV infection, the body's natural immune system tries to fight it. So it only gets to a point where the virus mutates so many times in the body, especially in the cervix, that it becomes impossible for your body now to fight against that virus. And then when that happens, by then, the client or patient will now start having symptoms. So in the initial stages of an infection, some people are able to clear it. It's not every HPV infection that leads to cervical cancer. And there are also certain types of HPV viruses. We have over 100 types of HPV viruses. Some are able to be cleared by the body, some are not. The ones most notorious for the cervical cancer is the HPV type 16 and 18, like we said the other time. Getting it doesn't necessarily mean that you would get cervical cancer, but getting it puts you at a higher risk of getting the cervical cancer in case your body is not able to clear it. So the incubation period is for a very long time. It can take as long as 15 to 20 years. Some can take as short as probably 5 years. So after that incubation period, then you start to show the symptoms of the abnormal vaginal discharge, abnormal vaginal bleeding, sometimes bleeding after sex. We call it postcoital bleeding. And then some occasionally, most times the vaginal discharge is quite offensive. And then they may also come with maybe urinary difficulties, weight loss, pain on defecation, anemia symptoms, inability to walk. That's in the advanced stages. They may come with kidney issues and spine problems. Those ones are usually in the advanced times. So that is why we say that it takes a very long time to show, because it has a very long incubation period. Yeah.
Okay. And before I go to our faith leaders, I also want to ask you, because the last time we talked about stigma, for instance, and I was reading some research online about some study that was conducted in Chicago in the US. And there was this question of, some people having the notion that the test itself could somewhat threaten their virginity as women. I don't know how. I've never really done the test. So you are probably best placed to explain this to us. How true is this belief or perception, and how does that complicate, the efforts to get women to be encouraged to screen?
Okay, so essentially, cervical cancer is HPV infection. Let me put it like that. It's a sexually transmitted infection. So it's assumed that to have a sexually transmitted infection, then it means you should have been sexually active. And when the test is being done, we pass a device we call a speculum. I wouldn't say it's big, but it's sizable. And you are passing it through the vagina to view the cervix. So people who have never had sex or people who have never been sexually active, passing that device through means that you're going to break the hymen to be able to see or view the cervix. So that's why it connotes as devaginization. But there are self-sampling ones that can be used that you don't necessarily need to break the hymen to do that. Yes.
Okay. Thank you very much for that clarification. And now let me come to you, Reverend Dr. Chimateamwa. How do we reconcile? Because in the intro, I said something about the fact that there is sometimes people who go for screenings, there is the belief that, oh, you don't have strong enough faith because you are screening for something that isn't there. It's like you are inviting that thing, whatever it is, into your life, and therefore that means your faith isn't quote unquote strong enough. From the perspective as a minister, how at odds is this to equate faith to doing something which the body needs, like attending a screening for something like cervical cancer?
Thank you. So I think it helps to take one's spiritual life or journey as a holistic one. So the God that we serve is spirit, and yet he made the human body. And the human body is flesh, which serves as the house for the soul and the spirit to dwell in so much as that if the body ceases to function, the soul and the spirit cannot continue dwelling here on earth. It must move into another realm. So it means that it is a holistic care. Now, God does not subscribe to us being negligent when it comes to the human body, because we are stewards of the human body. He tells us in Corinthians that this is his temple, and we need to take care of the human body. In fact, that is why you eat, and you don't say that by faith you should be full, but you go finding food. Yeah. You plan for tomorrow. You go and do shopping and prepare soup for the coming week. Mm-hmm. That does not mean you don't have faith. It is you planning ahead to take care of the body. In the same way, if you go screening, it does not mean you don't have faith. It means that you are being preemptive to see if there is anything at odds in your body that you must take care of. To solidify this point, as is God's wisdom for believers, Proverbs 22 verses 3 says that the prudent man sees danger ahead and takes cover or hides himself. But the fool or the ignorant one goes ahead and suffers the consequences. So right there in the scripture, you see that it is in God's own wisdom which he has given to us, and he's encouraging us to foresee danger and prepare, plan, and if you can hide away, hide away. So it is very much okay to go to the hospital and say that I've heard of cervical cancer. I think maybe I fall within the age bracket, and so I want to come and screen. There is nothing about it that diminishes your faith or that says that you don't have faith. Because as I said, then you might as well apply it to every other facet of your life, like eating, like even working to get some money. Everything we do, we take precautions so that we are prepared for the future. So it does in no way negate one's faith.
Okay.
Thank you.
Thank you. And Imam, I'll throw the same question to you. Is our faith weak if we decide that we want to go for screening? Because I found that this hadith that says, make use of medical treatment, for Allah has not made a disease without appointing a remedy for it.
That's very true. Thank you very much. I think that whatever we do as Muslims is embedded in divine legislation. There are various forms of divine legislation in Islam, but let me use this simple definition of legislation in Islam or Sharia, which has not been used properly. There is this famous scholar called Ibn al-Qayyim. He says, when we say divine legislation or Sharia, it is the foundation of, its foundation is wisdom and welfare of the people in this world and in the hereafter. It is about mercy, it is about well-being, it is about wisdom. So anything that turns wisdom to foolishness or absurdity is not from God. Anything that turns mercy to cruelty or hardship is not from God. Anything that does not inure to the benefit or the well-being of the individual is not part of divine law. There is nowhere in Islam that says that culture supersedes divine law. I'll give you a critical example before I come to the hadith you quoted. When the Prophet, peace be upon him, migrated from Mecca to Medina, he met a cultural practice of the people of Medina. Now, you know, Medina, they plant a lot of dates. You know dates?
Yeah.
Yeah. So, what they do in modern day science, I think it's called grafting. Or, I mean, those who have studied agriculture, you know how it's like marrying two similar species together, so that you can have a very decent breed, new specimen or something like that. So in the beginning, he prevented them from doing it. So that year, there was no bumper harvest. So they went to him and told him that, oh, this is what we used to do, and you prevented us, and now this is what is happening. It's what, so he told them that this issue has to do with how you live. I mean, it has to do with how, it has to do with your well-being and how you can make a bumper harvest. So from now, you can do it every time before the harvest season. I'm saying this because this is scientific, okay? And then he never prevented them from doing what is scientific. Now, life is at core essence of every religion. It's pristine. The Quran says, if you save one life, it's as if you have saved the whole of mankind. And then if through your carelessness, you lose one life, it means you have killed the whole humanity. The hadith that you have quoted means that you have no excuse not to seek for medication or professional medicine. What is the hadith saying? The Prophet ﷺ says, Tada'u, look for medication, look for cure. For every ailment or sickness has a cure. And what amazes me is he says, those who have the knowledge of the cure, they know it. I mean, you cannot just sit down and then say that I have the knowledge to cure this sickness. No. Curing sickness comes with knowledge, that we have an expert here with us. And then those who do not have that knowledge, they do not have it. And the only thing that does not have cure is death. You can do whatever you want to, let somebody stay a bit, but eventually the person will fall. So I don't think Islam encourages people not to go to seek for medication or to seek for cure. Islam is entirely behind seeking for cure and medication wherever you can find it, but you should also seek it from people who have the knowledge or professionals.
Okay, thank you very much, Imam. And I think just before I move to you, Dr. Nita, with the question about stigma, I'll stay with Imam and Reverend Dr. Chemateamwa on this question. But before I do that, let me just alert everyone in here that there's a QR code on your chair. Please, you can go ahead and scan and order. QIC is taking the tab for whatever you're ordering here this afternoon. So please feel free to do that. So Reverend and Imam, the idea that, doing screenings, for instance, is inviting something that doesn't exist to come into existence out of the blue, and is it more like a misinterpretation on the part of us, the adherents or the believers, rather than us sticking to things that are clear-cut, like the hadith that I quoted, for instance? I don't know who wants to take it first.
Okay, so I think it's been established from the earlier submission that the Bible, and from what Imam is also saying, the Quran does not frown upon seeking medical care. In Christianity, I think sometimes it has been the misinterpretation of the scriptures where people have gone to the extremes of taking the only faith approach. And that only faith approach means that if you even take paracetamol for headache, you don't have faith, you don't believe in God, you don't believe in the power of God to heal, you are denying the power that God has given to the body. So we know people who would not go to the hospital, who would not seek medication, who would only be praying and take other things outside of prescribed, qualified medicines, and would be in that state, and many end up dying. I have personally attended to patients as a medic, and there is a case where someone who had just finished giving birth and had complications from the delivery, had a lot of bleeding after the birth, and it was so bad that it had to be taken to the hospital, or was at the hospital but had to go to theater for further management. And as part of the requirement, the person needed blood to be transfused and other medications and workup so that the operation would go on well. I called my boss, we came in and we spoke to the woman that this is the case, it is critical, she's really bleeding so bad that we need to go in and help her. And she had just delivered a new, just few hours. And she says no, her faith and her church does not allow her to take any such thing. And we were telling her that no, if you don't take this, and this was like 1 a.m. in a district hospital. If we don't do this, we may lose you. You may not live. And she says no, she would rather pass on and die than to receive the intervention. And we said, what happens to your new baby? Well, I don't care, Boss came in, we spoke, we did all that, but she still would not, agree. And you couldn't force her because, it's a right. Yeah. And, you need to abide by the code of ethics and professionalism. Long story short, after some minutes, and she passed on. She bled to death in the hospital on the trolley because she refused to take the intervention. Yeah. Next day, community people came and the church leader came and some people, and then we asked that, is this what the church practices? And is this what, this was what the person was saying. To our surprise, dismay, and anger, the leader said, oh, these things we said, but when it is critical, you can take it and later ask for forgiveness. And we said that, but see how wrong teaching or miscommunication has ended, and she had 4 children already, has ended a mother who has gone on to death. So, yes, some out of misinterpretation of what the scripture says, take the faith-only approach and says that God has nothing to do with anything human, anything physical. Once you are sick, you need to do only prayers. But it is very clear and evident throughout all scriptures that God, who created the things that we see, has the power to use anything he wants to use to heal. He can use food, he uses water, he uses the medicine, he uses the herbs, he uses the things around us to heal. So, if you take it in a holistic way, it is both. Pray, yes, pray, seek his faith. He can heal divinely without using anything. He can also go ahead and use the things around us to heal. And so I think that largely is due to misinterpretation and people that take a particular tangent, to their own detriment, because that is not the candid revelation that we see in the scriptures.
Okay. And Imam, would you say same, that it's largely sometimes due to misinterpretation?
Yes, I think that wrong interpretation of religious texts has done a lot of harm than good. And I also believe that we have left issues of religion to the imams and reverend fathers, reverend ministers. All of us, as church people, as Muslims, must take the pain to read the religious texts and understand them, so that if you are being misled by a church leader or a Muslim imam, you will be able to find your feet. Yeah. You understand? And secondly, God has given you intellect. God has given you intellect. Sometimes you do not have to swallow certain interpretations, hook, line, and sinker. At least subject it to some kind of critical assessment before you accept it, especially when it comes to the issues about life and death. You see, there is a legal maxim in Islam that ad-darurat tubihul mahdurat. Necessity, when there is necessity, what is even restricted now becomes permissible. For instance, dead carrion is forbidden in Islam. You have to slaughter before you eat any kind of meat. But during hunger, you are permitted to eat, even if it's not slaughtered. Because if you don't do that, you will die. Yeah. A man is reported to have gone to the prophet that he had a camel. Now, he asked the prophet whether he should tie the camel and then put all his whether he should free the camel and then put all his hope in God that whatever happens, the camel will come back home. The prophet told him that tie the camel and then have faith in God. And then surely at any point in time you need your camel, you will get it back. For me, what usually prevents people from going to the hospital or to seek for medication sometimes is the abuse of what we call modesty. Abuse of modesty. Some Muslim women would never allow male, they will resist male physicians or doctors taking care of them. They would always want to have women or ladies. Now, some men would also not, find it, give out easy for female doctors to take care of them, especially if it's come to areas of opening of private parts and the stuff. But what we are confronted with is issue of necessity. And you know the legal maxim that during necessity, this is what happens. So we should not, as a result of this, we have lost lives. As a result of this, cases that could have been prevented or worked, remedied very early, at the time they go to the hospital, is in the worst condition. Yeah. So these are some of the things, and it's because of wrong interpretation of verses. It is clear-cut statement from the prophet. Seek for cure from the professionals. Those who have the knowledge, they have it. If you are fortunate, you have male doing it for male, no problem. If on the other hand, if you are not fortunate, it is the opposite sex, I'm sure medical professionals, doctors are trained that they don't even, what you see, they don't even look at, they go through those things, they don't even bother. So we are calling on the generality of the public. Health issues. You see, the Sharia takes care of the maqasid al-Sharia, objective of Sharia is 5. Number 1 is about life. Anything that will take your life away, we don't joke with it. Your intellect. So I will remain on these 2.
Okay.
Life is precious, but what will support you to take good care of your life is your intellect. If you don't use it properly, you will lose your own life when there are mechanisms available to save you from death.
Okay. Yeah. We'll come back to you in a second with another question that I'm sure will still touch on life and intellect. But Dr. Anita, I want to come to you also. I think we talked about this last week, stigma. And we've heard from Imam and from Reverend even actually quoted 1 Corinthians, where it talks about the body being the temple of God. How can we use such teachings, for instance, to counter the stigma that comes with it? Because, like you said, people assume simply because it's sexually transmitted, you must have been, the general assumption usually is you must be promiscuous to be able to contract this disease.
Hello? Okay, so yes, there's a lot of stigma associated with screening for cervical cancer, because people think that because it's a sexually transmitted disease, it's only those who have had sex with so many partners that would want to screen.
Yeah.
But the point is, you don't know the stats. Even if you are, in quotes, faithful to your partner, that one time can give you an HPV infection. You never know. Sometimes your partner may not be faithful to you. and that person goes around with other people, and that person is transferring infections or HPV infections to you. We've had instances where people come to you and their first sexual encounter, whoever they had their first sexual encounter, is a person they have been with their whole lives. And now they are being diagnosed with either a precancerous lesion or a cervical cancer. You would ask yourself, if this person is saying that this is the only person he or she has slept with, how come that lady has cervical cancer now? The thing is, you can't really judge anyone based on whatever. You can't really predict what someone would do. So that's why we advise that whether you are faithful or you're not faithful or your partner is faithful or not, just screen to be on the safe side. Like Imam is saying, nobody is preventing you from seeking help. Add wisdom to it. The fact that you think you're not being promiscuous doesn't mean that live in bliss and hope that you will not get the cervical cancer. You have to add wisdom. You have to prevent it. If it's once every 3 to 5 years.
For the screening.
For the screening. If you screen and you are screen negative, every 3 to 5 years you can screen. It doesn't take much from you to do that. And nobody is going to, at least I know no health worker is going to judge any woman that you are promiscuous. That's why you are coming for a screen. Maybe they think that to their friends or relatives or society, wherever they come from, they are thinking that they are rather promiscuous. But believe you me, everybody has their problems. So the least you could also do is to take care of yourself. You go to the health center, you talk to a reproductive health person, you want to screen for cervical cancer. We are even more than happy to have you to come. There's no health personnel who would refuse you because you want to come for a cervical cancer screening. We are inviting everybody. We want the woman to come. Please come for screening. You screen, you are screen negative. We give you subsequent counseling in 3 to 5 years. They always give this registration card. So sometimes they even call, if they are not lost to follow up, they call them in 3 to 5 years. Oh, your screen time is up. You can come and screen again. So that in doing so, be able to prevent the precancerous lesions. Those who are negative, now there are vaccines available. So, sorry, there are vaccines available. So if you screen and you are screen negative, you can take the vaccine and prevent yourself from getting cervical cancer later on in life. Because if you, let's say you sleep with someone today and the person has the virus, you may not show symptoms for 10 years. So it's possible that the next 3 years you are screen negative, but it's still within the incubation period. What if the next 8 years you screen and you are screen positive? Then that ignorance you thought you had, or that view that you don't have the cancer, it's gone. And because you thought maybe one time I screened, I'm not going to screen again, or I believe that I will not get the cancer. Before you realize, in 10 years' time, you have a pre-malignant lesion, or you have the cancer itself, and then by then it would be too late. So we are all supposed to, not that we are supposed to marry the religious and then the scientific aspect. Just as science works with proof, science works with evidence, science works with what word should I use? Yes, now we do evidence-based medicine. A lot of studies all over the world has come to a conclusion that screening prevents cervical cancer. It reduces the effects of cervical cancer on the woman, on her family, on her community, on the population. So why would you, after so many people have spent so much money gathering evidence to prove that prevention or screening or vaccination reduces the incidence of cervical cancer, you, one person, will sit there and close your eyes or close your mind and say that because of faith. Faith is not bad. Faith is good in a lot of senses. Sometimes it's good, especially when it comes to mental health and all that. It helps, but it doesn't mean live in a cocoon, live in your own place, and then ignore the fact that you can get cervical cancer. If you come and we screen you and you are negative, you continue.
So that's a little bit I have to say about that.
Okay,
Yes.
thank you. Reverend, before we move to some of the other, we're doing mostly the faith and religious bit of it. We'll talk about the culture in a minute. But I want to come to you because this is quite prevalent in Christianity. I don't know so much about Islam, where people fall sick and they'd rather go to prayer camps, sometimes fast for days, stay at the prayer camp hoping that they get the healing rather than seeking some medical treatment. And we've established already that in both religions you are allowed, and it's actually wiser to go get some professional screening for whatever condition you have. At what point does it become empirical or imperative on the religious leader to say, okay, this thing, you've been here for X number of days, we've been fasting and praying, I think it's time you go see a doctor, rather than continue to stay here at the camp hoping for some healing?
Thank you very much. You've hit on a very important aspect. And again, I think it is also partly due to the leaders in these institutions. Perhaps we need to review how churches or religious institutions are asked to operate or permitted to operate in this country. I know of, I think, Rwanda, where you need a minimum qualification to be a church leader. And in Ghana, I do not know, if you are checked whether you've had some basic theology training to set up a prayer camp or to set up a place. Because indeed, many have lingered and even died in such prayer camps, which is very, very irresponsible. But let me draw the curtain back and let us understand a bit of the African or the Ghanaian and our roots and why this is prevalent. As far as we know, in our cultures, and then even in some Christianity circles, every disease is a spiritual problem. Every disease. So every disease was given to you by a spirit. You've offended the deity. The gods are angry with you, or it is witchcraft. There is always a spiritual attack. So much so that even if mosquito bite you and you get malaria, witches are giving you malaria. And that is how we found ourselves. So growing up, when people were sick, they'll go to the fetish priest who would do all kinds of incantations. Yet they will also put some herbs together and give to you. So, coming up as our culture, there is this very blurred lines between spiritism, herbalism, more of the spiritism that every disease is caused by a spirit or a demon. Yeah. But now we know better. If you litter your environment and you have mosquitoes biting you and you get malaria, I don't know that the spirit that gave you that malaria. If you go take water that is contaminated with germs and you get cholera, I don't know if that is some witches giving you cholera. Yes, there are spiritual, diseases that is there. In scripture, Jesus has healed many people where he cast out the demon and rebuked them. They left and the people go well. But there are also those that have been through natural cause. Paul, who is one of the greatest apostles and written about 2/3 of the New Testament, told his protege Timothy and said that, take a little wine because of your frequent tummy infirmities or your stomach infirmities. Indeed, he was going on missions and he had Dr. Luke, who was also one of the people who wrote the Luke Gospel. He was a physician and he accompanied him, guiding him and helping him and giving medical advice and counsel and remedies. So if you are sick, yes, pray. There's a story in the Kings about King Asa who had a disease, and the Bible says that instead of seeking the Lord, he sought the physicians. So again, due to misinterpretation, people have taken that and ran with it. And God was angry with him. And they say, because he sought the physicians, that is why God was angry with him. But He did not consult the Lord at all. And what we are saying is that when you are sick, pray. And when you pray, lift up your eyes and go to the place where there is support. Jesus performed a miracle on a girl who was dead, Tabitha. And he said, Tabitha, Kumi. So the little girl got up. Immediately he told the parents, give her something to eat. So you see how even Jesus recognizes the place of physical things for the body's well-being. He could have also made him full. There were 5,000 people listening to him in the wilderness, 5,000 men plus. And then, and he had to take physical food, multiply, and give to them. He could have made everybody become full. Yeah. So it is taking the thing in a holistic manner that food is also medicine. They give you vitamin C when COVID came. People took vitamin C. But we also know people, there was the neem, there was the lemongrass, there were other things, which we know that also contains vitamin C. And it is food, and it goes in to heal you. Now, it's not the devil that created the lemongrass, nor the neem tree, nor the plant from which we get the artemisinin, of which we get the anti-malaria medication. God created everything. So, and it's the same thing that the doctors would distill and go to the lab and do extraction and come up with medication so that it heals you. Why are you limiting God to what he can use to heal? Why are you limiting him and say that only he do it divine? He can do divine by giving manna, but when they got to Canaan, they had to plant. And in their planting and their working, he poured his blessing upon it and they had to eat. So I think it's a holistic thing. Faith leaders should encourage people who come to them for healing and say, yes, I've prayed for you. Go. Show yourself to the doctors. Let them test you and let them also do their bit because we are all working together.
All right. Thank you so much. And Imam, you did touch on modesty, which I want to come back to before I know I said we were going to culture, but I have to. Okay.
I wanted to add to what Reverend has said. You see, faith, the Muslims call it Iman. Or faith, or let's say religion, or spirituality, encourages prayer and reliance on Almighty God. But science and medicine protect this very body so that you can stay stronger and be able to do more prayers. That will get you closer to the Almighty God. But in Islam, there are certain contaminants of faith that when you go through those things, your faith is even regarded as weak. The people even regard you that you do not have even morality. For instance, we do not have, in this part of, in the southern part, we do not have these camps. But in other parts, it's similar to what we have churches, like camps where sick people are sending. Now, somebody is sick.
Sorry, go ahead.
A sick person, you visit him in a prayer camp, even the approach is very wicked. He's being chained. He's not being given. The Master Jesus himself, just after raising the Tabitha, what did the Reverend say?
Give her food.
Give her food. Are they giving food? Are they fed well? I mean, they are treated like criminals if you go there. And how, Doc, if you are treating us like criminals when we come to the consulting room, do you think we'll come there again? Anytime I go to the consulting room and I speak to the doctor, seriously, wallahi, I go home very happy. I go home. There was a time, even within my family, maybe I used to be a very good footballer, and after now the body doesn't look nice like before. Yes, but to be a very good footballer because of the nature of my body. Anytime anybody sees me, he can tell me that, oh, Abbas, I think you have to check for this. You have to check for this. But when I go to my doctor and then I come out, I know A, B, C, D, and I know I've done well. I'm always happy. Now, the issue of camping or the issue of preferring to go to soothsayers, to go to marabouts, to go to quack malams and imams, to seek for cure. We made it clear that the Prophet said, Arafa man arafahu. Cure, those who have the knowledge are the only people who can cure. And the Arab says, Fakidu shay. Anybody who does not hold grasp of something, la yu'tihi, he cannot give it to you. Sometimes the marabut looks very sick than even the sick person sent to him. So the use of the intellect is very, very important. Your faith does not prevent you from seeking for medication. If you do that, you have not even used what the blessings that God has given to you.
Okay. So now let me come to the cultural question I wanted to.
You were talking about modesty.
Yes, that's what I'm coming to
Okay.
now. Because in the Ghanaian context, usually we see the man as the head of the house. And there was this study that was done in Kumasi on cervical cancer where the men said they don't feel comfortable with a man, a male physician doing the screening for their wives. And sometimes they said they would rather the wife asks permission before they go. And what I wanted to link it to was this Chicago study I referenced earlier, where modesty was an issue also for especially the women, because it was a study done among the Muslim community in a suburb of Chicago. And so how do we marry this issue of, oh, our religion requires modesty versus this is what this particular condition, to avoid it, you need to be screened. You would need to, derobe at some point for the examination to be able to take place. How do we balance this requirement of, say, the religion and what the science also requires?
Modesty is a good value. I mean, especially in women, in ladies. For instance, in the Muslim community, modesty could even attract men to a woman to, marry her than beauty. I believe in so many other communities, this is the same. Now, modesty shouldn't be used wrongly. You are pregnant. Let me even put cervical cancer aside. You are pregnant. You are in your last trimester. You are almost getting there. And because of modesty, you would allow, you don't go to, you don't allow yourself to be seen by a male doctor or something like that. For some, the abaya, the hijab, they won't even remove it. These are all issues that have to be addressed. And how do we address them? And I said there is a legal maxim in Islam that prevents it. They say it's called darura, necessity. When there is necessity, like I gave an example with dead carrion, which is haram, but in the absence of the halal one, you are permitted to eat.
Yeah.
You understand? So it has become a necessity. And there are three things the religion says when you commit them, when you commit sin under these three conditions, they are not regarded, they are not recorded. One, if you do it under duress, for instance, during the revolutions day, if a gallon of alcohol is found in your vehicle, those days, I don't know how many of us were adults, were good enough to recognize those things. For allowing somebody to do that, to do kalabule in your listing, all of you must taste it. Even if I'm an imam and then your beer touches the ground, you will drink. If you don't drink it, you will suffer the consequence. So under this condition, it is under duress. You have to take it. Now, where you find yourself with your modesty, it is a necessity. And if even you do it, whatever you fear that you have committed a sin is not recorded as a sin. So, but it's a big challenge, I must tell you, especially in the Sunni communities. Among the elites, it's normal. But in the Sunni communities, the purists, they, trust me, they will struggle and make sure that you don't have access to where you are supposed to take care and then look at and then take good care of them. So what do we have to do? We need to intensify education. We need to, the Friday sermon is the most important one, and we need to do it. And sometimes, coming to Dr. Anita, I'm going to worry you a lot now. I'm going to prepare my abaya for you, nice one, and I will bring it to my mosque so that you talk to my people for me. It's very, Reverend, I will be inviting you to the mosque, especially the police mosque. You know, the head of the police chaplaincy, Reverend Father Atta, I think it's an Anglican bishop, very interesting person. We do all some of these things. Sometimes we have to collaborate and talk to our people together so that they understand it. And I also think that when the medical professionals come closer to the people, go into the community, do a lot of outreach, they will sort of accept them to do that. But on that modesty issue, there is a lot of work I must consider we have to do.
Okay, thank you for that, Imam. Doc and Reverend Doctor, I'm coming to you with this question. And for those who are joining us now, there's a QR code on the arm of your chair. Please scan it. We have food, we have drinks. QIC is taking the tab for that, so please go ahead and scan. As you can see, I've been reading a lot. 3 sessions is enough to make me become almost qualified for medical school. And I found another study in Zimbabwe where the women who were interviewed said they did not seek treatment even after they were diagnosed with the cancer because, oh, my grandmother, she had cancer and she just took the herbs and boom, that was it. She was cured. So, and one woman actually said, I think I wrote her response. She actually told, researchers that her grandmother's cancer was cured because she took herbs. So, and I think Reverend also mentioned, we grew up with that culture where people rely on the herbs. It's good, but does it cure everything? I'm not sure. So how do we marry that belief, cultural belief that the herbs take care of everything, including whatever cancer we may have, whether it's cervical or any other type of cancer? Dr. Nita, okay, yeah. And then Reverend Doctor will take it next.
Okay, so I'd like to say that most of the medications we have herbal backgrounds. Yes. Like Reverend said, the artemisinin derivatives, they came from herbal backgrounds. neem sometimes. We have rubber, which is from that. We have a few other plants. The one I've forgotten. We add pineapple and boil together. Lemongrass, yes,
Yeah.
lemongrass. It has medicinal background. It has herbal backgrounds. We are not saying the herbs are bad. They are all used to. The stuff are added to them to come to our medications that we take. But the issue is the herb you are taking the right medication for what you have? The lemongrass and I think pineapple and cassava leaves also. I've forgotten the combination. They boil it to, in quotes, treat malaria. I guess it works. I don't know.
I don't know either.
Coartem is used to treat malaria.
Yeah.
It works. But if you are sick and you tell me that you're going to pray and not take your Coartem with high fevers, 40 degrees, 39 degrees, 41 degrees, that high fever would kill you before your faith saves you. So while you're praying on the faith for the malaria to go away, why don't you take paracetamol? Why don't you take Coartem? Add on to that and heal yourself so that you can be healthy enough or strong enough in 2 or 3 days' time to continue praying. The same goes for cervical cancer. You're screening not because you think that you can never get cervical cancer. You're screening because should you get it at some point in time, especially the pre-malignant lesions, you will take preemptive measures to make sure that it doesn't spread and it doesn't cause havoc in your family. Because if a woman gets cervical cancer, we see them in our clinics every time she comes. We've had 23-year-olds who had cervical cancer. We've had 36-year-olds who had cervical cancer. We've had 28-year-olds who had cervical cancer. Probably they started their sexual experiences earlier, maybe 9 years, 8 years. Or they had the fast-growing ones, maybe 5 years, they showed symptoms. Here is a woman who has one child. And it was even found out when she got pregnant. So she came for antenatal, complained of some sort of abnormal vaginal bleeding. And in pregnancy, I mean, you're not supposed to bleed. So somebody examines her and sees that, the cervix looks funny. This is not how a pregnant cervix should look like. We took a biopsy of it. Lo and behold, it was cervical cancer. And she had gone beyond the pre-malignant stage. So she now had the cancer of the cervix itself. This girl now we have to end her fertility for her. So waited for her to have her child, and then we took out the uterus and did a few other things for her. So for her, that is all for her, in quotes. Somebody comes at a later stage. She's beyond surgery. She does chemo and radiotherapy. She lives 3 years and she passes on. She has left her 3 or 4 children in the house. Other people come, maybe older, maybe younger. But the point I'm trying to make is that we do not sit and pretend that cervical cancer is too far away from us. Everybody is at risk of it. So long as you are a woman, you have a cervix, you are sexually active, you can have the cervical cancer. A few times we've had, I think, a few in not sexually active people, but that is the very minimal or very few group of people who we don't want to go there now. But majority of the people are in the sexually active group. And then as I was earlier on reiterating, education, like Imam was saying, it helps a lot. It would surprise you to know that you would go to a community, especially the patriarchal communities, where the men probably may have heard about cervical cancer, but they don't really know what it is. They don't understand what it is. And to them, what they understand by it is going to open your legs for another male doctor to look at your private parts. And I mean, it's understandable. Most men don't want another male person to look at their partner's private parts. That's okay. But there are midwives around, there are female doctors around, healthcare workers. We don't have only males doing it. If you are not comfortable with that, we can get you a female person to screen. And even if it's a male, I don't think it's on their mind like that.
Yeah.
They just come to screen, and they are seeing so many of them. It's difficult to keep track of all that. So I think it's just a bit about the education we need to keep on hammering to people in the mosque, in the societies, in the banks, in the churches. Most churches even have maybe twice or 3 times a year where they organize these health talks, where the doctors come to talk about, it could be breast, it could be cervix, it could be hypertension, it could be diabetes, it could be anything. So we could even use those times to discuss that as well. We go to community health centers. They are the ones that the community nurses, they reach out to the people at the very baseline levels. We can also use them to make sure they talk to them about it. Every time anyone comes to you for a visit, we talk to them about how we make our clinics patient friendly. Because if the person comes and we are prejudiced against them, somebody come talk about screening and hey, and then now you're now best screening. You put the person off. I had a friend talk to me about going for screening in one of our centers, and I think it was a work something. So all the women in their place were supposed to go for a screen, and then she goes there, and first and foremost, there was no pre-screen education. So she was like, "Hey, what's this? I thought this place is supposed to be high tech, so you're supposed to be nice people. No pre-screen education." Then the midwife or healthcare worker, whoever it was, tells her, "Madam, go behind the screen and undress." She forgot, so unfortunately she wore trousers. So she's not wearing a skirt, so that means she has to take the whole of her lower side off and then leaving her upper part. And then she's done. She said, "Okay, Patrol, can I have something to cover?" "Madam, dampaniso." Just like that. So she goes to lie down there, no cover cloth, nothing. She's just lying down on it. I don't know whether the healthcare worker assumed that because she was a woman, it was okay to bear the woman like that. But it's not right. She lies down. She said, "Oh, Pacho, what are you coming to do for me? Is it painful?" Oh, go. I mean, that is something you don't see. And this girl complained about it for over 20 minutes. She was talking to me about it. So if she's going through this, you can imagine what the other workers, female workers who went there also felt. And that means that the next time they are coming for a cervical cancer screen, that is what is on their mind. Or if they're going to tell somebody about it, "Oh, when you go there, they are not really nice people, or they don't really take their time." And I mean, people have different views about things. So if I'm assuming that even you that you have 3 children, you're saying it's painful, how much more me? Then, okay, I'd rather not screen, or I'd rather live in bliss. So those are a few of the other things I also think we don't do well on our side. I'm taking blame for whoever did that. The person didn't do well on our side to push people off from doing the screen. I don't know. I think, let me pause here and let's Reverend also.
So Reverend, the modesty question, and then the question also of, the herbs can definitely cure me even if I've been diagnosed with a cancer.
I think Imam and Doc has said extensively on the modesty that when is the necessity. I bet you that if you are involved in an accident, modesty will fly out of the window. I mean, you are bleeding, and look, you want your life to be saved. So yes, is good, but I think it's been expressly explained that it has its limits. When it's life and death, you need to receive the help. And I personally say that in this world, you have to be vulnerable before someone at some point. You have to be vulnerable to someone. Thank God it's not the whole world you are being open to. One. And that person has the knowledge to cure, as we have, been admonished. So, yes, let's open up because we know what we would get. The herbs one is a big challenge because we are Africans. This is our roots. This is what we've inherited. But they say that when you know better, you do better. Now we are going to learn. Thank God now we train herbal doctors who go through proper clinical training in our medical schools and pharmacological schools in the country. There is a Mampon Center that also does a lot of quality, work reviewing medications. If you think herbal is your line, go speak to them. Because they are professionals, they know what the herbs can do and what it cannot do, and they will give you explicit advice that, yes, our herbs can treat A, B, C, D, but this one, you need to move on to this stage. Because, like Doc will explain, there could be several types of management that herbs will not get to that point. Herbs may do a little, but it's a whole, sometimes some radiations and some chemo. It's a whole lot. And the herbs may not have the potency to go on to give you that full treatment. So I think we would encourage that. And I think we've also, on this platform, explicitly stated that our herbs have virtue, our herbs have their very good benefits. We've said that. But there is always, a limit. I mean, you can't... every problem and what you need, what it will require, right, to solve. And I would also want to add that let us challenge our beliefs. You see young children, if you have young children, when they watch Superman, they believe they can do everything. Look, they think they can climb a 3-story and jump, and they are Superman. That is a child's belief. But you and I know that, no, it's just a belief. If you try it, you are gone. Okay. So we may have assumptions and we may have beliefs. Let us test them. Ignorance is not bliss. It's like, if I don't know, then it's because I won't go to screen. Oh, these people, as you are going, they are going to tell you, as for me, I don't like that. Look, if I don't know, I don't know. But we know that ignorance is not bliss. Let us confront our fears, confront the things that, are ailing you, and get to it and deal with it. And, it may not be as bleak as you might think it is, and there is help and there's support. So I think, we open up our minds, do dedication, seek help, and just keep the communication rather than suffering. I've had relatives who, same condition, and stay till late, will not go to the hospital. You say, oh, no. And when they went, it had metastasis. It had gone to other parts of the body, the lungs, and it was just too late. And nothing could help.
Okay. Well, before we open up for questions from the floor, in Ghana, of course, we know that the imams, the pastors, your platform is really solid. It's the one, what does Adum FM say? Muna muketa platform, or something like that. So at this point, how should religious leaders use their platforms, when it comes to encouraging screening for cervical cancer? I know, Imam, you spoke about tapping Dr. Nita and Reverend at some point, but what else do we need to do at that level, as religious leaders to also encourage, because of the position you hold, I feel your voice probably will carry more than just say even running an advert on television saying, listen, you need to screen for cervical cancer.
I should start.
Yeah, okay.
Okay. So, in Quran 16, verse 43, the Quran says, ask those who know. A bit of the natural medicines. I hope, Doc, you are aware of this time around something called prophetic medicine. It's just like the natural herbal medicine. We have Muslims who practice those things. They use herbs but over-reliance on this is killing people softly. So let's go to the professionals and seek for proper medication. Now, what role can religious leaders there is an aspect that I wanted to hammer. Now, religious leadership is also business. We have monetized it, and that is why we are not encouraging people to seek for professional medication. Some imams and some pastors have consulting rooms where people pay. You see, we are dealing with God. We all, Muslims and Christians, believe that God is the healer. If an imam or a pastor bargains with me to pray for me because I am sick, we have signed contracts. If I get healed, he has to take the money he collected from me. If I'm not healed, he has to pay back the money because it's a contract. But if a pastor or imam prays for me, it's just like a doctor taking care of me. After that, I can say, thank you, pastor, and then give you whatever I want to give to you. But for you to extort money from innocent people and make money out of their sickness, and not even giving them the proper medication, the proper remedy, this doesn't come from God. As religious leaders, we have a platform, and the platform as Muslims is the pulpit. This pulpit is used every Friday. We must vary our sermon and not to make it entirely paradise, hellfire, paradise. We must talk about contemporary issues from health, from economy, but we must run away from politics and talk about leadership and good governance. Partisan politics may not bring you something good here in Ghana, but elsewhere, nobody cares whatever you say. Secondly, as an imam, I preside over naming ceremony, marriages, even funerals. These are all occasions where I can get the attention of the people. So let's use it and then educate the people. I also want to tell my fellow reverend ministers and imams that the fact that we are the leaders of the mosque and church doesn't mean we know everything. That is why I brought Quran 1643. There are a whole lot of professionals in our churches and mosques. Let those professionals also be part of the conversations. For example, if you have Dr. Anita in your church or your mosque, and you don't give her platform in the church to educate people on health issues, if you have somebody who knows about financial literacy, and you do not give him the platform in the church or the mosque to do some kind of education, then we will remain at the level of deliberation, talking big, but there will be no action. Then secondly, or number three, we have to do a lot of collaborations. We have to do a lot of collaborations. The clinics, the hospitals, on health issues, we need to interface regularly and then give them the opportunity to also educate our people. Now, I'm happy you are coming up with a fund.
Yeah. We'll get to that in a second.
Yes, we'll get to that, but I'm saying that at the micro level, at the church level, sometimes people don't want to go to hospitals, not because they can't afford, And not because they don't want to go, and it's because they cannot afford.
Yeah.
There are so many areas where we give support systems, but issues of health sometimes doesn't concern us. These days, when I look at something of maybe, for instance, 1,000 cities, 2,000 cities, you see Momo lines flying on social media. Sometimes I cry over some of these things. But the churches and the mosques can use it as an avenue not to always consume everything that our congregant gives, but we should have some part of it to take care of the poor and needy. As for giving them food, I know, for instance, we are in Ramadan. Where I come from, the police mosque, every day, these guys are witness. We can feed about 700 to 800 fasting people, sometimes more. But you go through the queue and see, some of them are not healthy. Health-wise, how are we supporting them? It should not only be talk. We should also facilitate their medical care. I have a friend who used to give me money, 500,000, said, go to Kolebu, pay for everybody who can't pay his debts or bills. I went to, for instance, I went to Tema General Hospital about 5 years ago, and you know, sometimes some people cannot go home even through the welfare system because they are a bit cured, but they are owing. So we were paying bills and we were not allowing them to know our contacts so that they don't worry us to say, I thank you and do something like that. And one of them told me that, am I sure that we are paying for him? I said, why are you asking me, sir, am I sure? What did me want him? I said, we need more, baby. So these kind of things put happiness in people. Let's surprise people sometimes with some of this approach, and the concern that we have goes beyond just talk to real action and transformation.
All right. Rev? Oh, okay. Yeah.
Okay, so I wanted to make a point that the faith-based institutions, or the churches, the mosques, and the other ones, it's imperative upon them to view medical practice as a tool to help in the stewardship of the body. And preemptive care or preventive care should be talked about in their churches. That preventing something, not even, let's say, okay, we are talking about cervical cancer, but screening for cervical cancer doesn't mean that you lack faith. They have to stress upon it in their churches or in their mosques. I wrote something here that viewing medical proactive health measures is not a sign of a lack of faith, but as a tool provided by God for stewardship of the body. So as we are proactively screening for cervical cancer, we should talk to our people, let them understand that God gave people medical knowledge for something.
Yeah.
It wasn't just by chance that it happened that people started thinking about other things. Let's take cesarean section for one. Years ago, cesarean section was a death sentence. I mean, even before it was there was nothing like cesarean section. It was just vaginal delivery or nothing else. So if for some reason, let's say you have a transverse lie, that's when the baby lies across, or the baby is too big, or for some reason the baby cannot come out vaginally, or the head is positioned in a different way, that means that that woman was going to die. Either the baby would die or the woman and her baby would die. I watched some movie, one of these medieval movies, where the baby was a breech. So the midwife tried to turn the baby and it didn't succeed. So the plan, it was a king's wife, and she had female children. She wanted a male. So this male that is coming was the one that was breached. The midwife tried to turn, it didn't turn. So then they had to do a cesarean section on this woman. And that meant that that woman was going to die, because then they didn't have measures to stop bleeding and all that. So they told the king he had to go and tell his wife and come see this woman screaming, no, we can't, just now I've gotten my meal, I'm going to die. Eventually, the cesarean section was done. And that time, cesarean section was holding your legs and hands by 4 or 6 strong men, where without pain relief, they are cutting your abdomen, cut through to your uterus, get the baby out. There's no way they could stop that bleeding. So that woman would die. Down the line, God gave some people knowledge that women are dying too much from delivery. Babies are dying. Some of these deaths could have been prevented. Why don't we start thinking about ways of delivering the baby other than from vaginal? Down the line, cesarean section started coming up. If that wasn't done, many more women would have died by now. So the same way, relating it to cervical cancer, people realize that there's something that is happening to our women that is giving them offensive vaginal discharge, abnormal bleeding, and then we realize that when it gets to a later stage, this is what we find in their vagina or their cervix or something. So people started developing vaccines for it. People started thinking about, okay, it took this woman 5 years to get to this stage. Why don't we go back 5 years and see? Then somewhere along the line, pre-malignant lesions started coming up. Okay, so if we're able to remove the pre-malignant lesion, this woman is able to live 10 years longer. This woman is able to live 20 years longer. Last time we had a patient come in who has been able to live for 5 years extra, 6 or 5 years extra post-hair treatment. And she even had a later stage, I think she was at stage 2 or something. She's able to get extra 5 years. Imagine this woman had not sought help. She would probably have been dead by now and left her 5 or 6 children, 6 children for whoever to care for them. God knows what would have happened to her kids now by now. So I'm saying that religious leaders should include that medical care or science does not mean that they should forget their faith. They should tell their members, they should combine, they should marry the two. Yes, I'm going to pray, but I'll go to the hospital to screen. Yes, I'm going to pray, but I'll take my medication. Yes, I'm going to pray, but I'll take my chemo. Yes, I want to go to church, but I'll still take my radiotherapy. So at the end of the day, we are all winning, and nobody is going to be against each other. There's nothing like science against faith. It's science with faith. So at the end of the day, we come to success.
Okay, Reverend Doctor. Yeah.
Thank you. I think Imam and Doc has made the work easier for me. I think we are establishing on this platform that don't separate your faith from the well-being of your body. Because the God that we serve, He is spirit, yet He made us to stay here on earth. And over here on earth, we have to deal with things that support your body. I said, no matter how spiritual you are, if your body does not function, you will leave here. We say goodbye to you. You cannot function here. And to religious leaders, again, as has been said, I would encourage us to take time and study the word. Read around, read, so that you understand properly how to explain the passages to the congregation. Anything that takes life away, Jesus says, I came to give you life, and may have life and have it more abundantly. To add to what Dr. Nita said, you go through science and you see a lot of Christians who did inventions. Isaac Newton, that is known for gravity, top Christian man, has done a lot of research. A very significant one was Benjamin Franklin, and you can read about it. And in his days, in the Puritans, when there was lightning, a lot of houses caught fire and people died. Because the thunder was striking, and lightning would strike on farms and on huts, and it would burn houses and families to death. Now, when he tried to question and ask, what could we do? The religious sect in his time, leaders, were strongly opposed, because they said, but this is an act of God. I mean, this is tender striking and burning homes. Do you want to oppose God with signs? What? In the same way, when people want to give medication and say, hey, this disease is the will of God, are you opposing God's will? If God wants a person to die, why are you opposing? And I think, again, that is a wrong interpretation of the total scripture. But Benjamin Franklin pursued his cause, did a lot of experiments, used the copper wires and all that, till the point when he realized that if he could hang a wire on a building and get a pointed, top, all these electrons and all kinds of science, the tender can, the whatever electrons it emits can pass through the wire into the ground. And when he did it, and they did it on the building, the tender came, the lightning came, and it went through, and it was conducted as the earth, and it went through the earth, and that was it. So through scientific discovery, lives were spared, and today most tall buildings have the earth. If you do your electrical design, there's always an earth component that goes to the earth. That is how far we've come. So it is painful, it is sad, it is unfortunate, it's a bit backward that today, 2026, AI and all kinds of things, people would still permit themselves to be misled, to think that you are sick, just sit there, only pray to a divine being, don't seek care, fast, and just stay there. And I think if you do that and go to the other world, you'll be questioned. So for religious leaders, it's been said, let's use our platforms. We carry a lot of weight. What we say is very, is really held in honor, and people want to live by it. The second thing I would say is that we can also start holding, within a particular context, our members accountable. For example, so like you said, sometimes we do screening. Today we are talking about cervical cancer. Tomorrow it might be hypertension. And you want to ask, have you done your screening this year? Have you checked? Have you done? Sometimes just asking, we say, hey, my pastor asked me, okay, you let me go and do. So that I tell, pastor, I went to do this. Have you taken your medication? Have you gone to the hospital? How about your children? Because as religious leaders, we are not only saving the soul or supporting or working with God to save the soul. The soul must live in a healthy body. The soul must live in a healthy body. And so it should be holistic, care for the soul, care for the spirit, but also care for the body, because you need a horse to run for the messenger to deliver the message. If the horse dies, the message cannot go on. And I want to also use this platform to, I know there's a ministry of religious affairs and all that. Maybe it's time we began to also critically look at our whole religious system in the country, the quacks and people who are just drawing people to their death in the name of akwanchere, which is, some are just not, some are just business and profiteering from members, and ignorant people in their desperation will do anything to receive care. And many die, but they die quietly and we don't hear. I think help is here, and we should use all the means that are available. We also thank you for these platforms where we can reach out to masses and use this to engage and let them know that, and let us do better, because now we know better.
Thank you, Reverend. Questions now, comments if you have any. And there's a microphone, so just raise your hand, we'll bring it to you, and then we'll take your question or your comment. Okay, there's one here.
Okay, good evening. My name is Dominic. Please, my question is to the organizers. I think we are talking about culture and tradition. Okay, so I see a reverend pastor who is also a doctor. I see an imam, but I think in Ghana we have three most common like religious groups. and I don't see the other one here. So it looks like we are leaving them out, but we shouldn't forget they also have a large group. I don't know for Accra, but where I come from, I think they are there. They are still operating, and as it stands, I mean, some ladies in your period, you are not even supposed to cook for your dad, and all those kind of things are still around. So I think next time we should also look at inviting
the traditional religions.
Yes, please.
Yes.
Okay.
Yeah.
So that's my first question. Maybe later on. Another one.
All right.
Thank you.
Thank you. Point noted. Yes. Any question, comment? Okay.
Yes, thank you so much. My name is Masube Balum Rahim, and I'm the public health, that's the National Officer for Public Health, FGMAC, as in the Federation of Ghana Medical Students Association, and I'm a student at the University of Ghana. Yes, so I'm really excited about some points that have been raised here. Yes, so one has to do with the fact that as a student, I've been hearing from some patients who come with complications to Kolebu Teaching Hospital, and they are admitted there, and usually they come at the latter state of their condition. And when you dig into the stories of those patients, you realize that they've been to a particular hospital before, and they've been diagnosed of a particular condition, and someone has conspired into their ears that they can use some herbs to do the treatment or to cure that condition. And so they ask for discharge against medical advice, and then they go for that herbal treatment, and later they realize that things are getting worse, and that now informs them to get back to the hospital. They come, and it is in that patient. So I think it is already established here that some of us Ghanaians are not given the right education out there, both from the religious side. And like my brother said, I think some of these people who practice the herbal side, most of them are the traditionalists. So if they were also here and they have also admonished and kind of spoken to the people, like the Imam pleaded on his colleague Imams not to mislead the general public, and encourage them to encourage their members to seek health screening and all those things, the same way with our Reverend Doctor, who has admonished his colleagues not to give misinformation to their people, and admonish them to go for screening. If they were also here to at least admonish their people, I believe that their people would have heard, and I know your platform is a large platform. Their people would have heard, and then at least turn a good leaf to some of the things that they are doing. Like Imam said, some of the people are doing it in a form of business. They feel like that is the avenue for them to generate their money, but they have forgotten that they are sending their client to their graves at an earlier stage. So the Reverend Father or Doctor has made a point of the Ministry of Religious Affairs coming in to come with regulations that will help regulate some of these people who are into those religious stuff. But I want to throw a question again, like apart from just the Ministry of Religious Affairs, are there other institutions in Ghana that we can put in place to help with controlling people who are giving misinformation, so that at the end of the day we can increase health awareness with very good information that will end up stopping some of these problems that we are facing in Ghana?
Do you mean misinformation in general, or misinformation as it pertains to health?
Health, not in general.
Okay.
Yes, because like I told you, people are advised that there's this treatment outside the hospital. So go and seek for it. Meanwhile, that is not so. It's not only limited to cancer, like we are discussing here. If you look at hypertension, people have high blood pressures. They give them medications to take and come back for adjustment. they go, maybe the first time they realize it's not working, someone gives them wrong information, and then they stop it and they're doing something else. They go back to the hospital with stroke. You get in? So, but meanwhile, your doctor probably had given you that medicine to, the drugs work differently for different people. So if you go back for review, probably they would have adjusted it to a state that one will be working so well for you. But because someone has deceived you, you ended up facilitating your death. So that's what I want us to look at it, to see how best we can stop that in Ghana. And my other question would have to go to Doctor. But please, working is one of the most prominent facilities in Ghana. I don't know how close you are to the Ghana Health Service. With the vaccination for cervical, as in the cervical cancer issues, I noticed that one of the days I was in one community, and when the doctors, as in the people giving the vaccination were coming, the children were running away because they felt like they are going to inject them. Yeah, so I believe, or I'm tempted to think, that there is a whole lot of barriers in that area, and the ministry may not have met their target. Like, if you are that close to them, how is it like, and how can we be able to get every person within that bracket vaccinated? Because it is believed that if you are able to get almost every Ghanaian female within that age bracket vaccinated, we will go a very long way to keep cervical cancer spread.
Okay.
Thank you.
So I guess there are two questions for mostly the doctors. Health misinformation, is there like a department, a unit, government agency that can control that? And also, how do we get the people who need vaccinations to get them? Yeah.
Okay, so on the health misinformation part, I think that one is, I don't know how they are going to stop people from preaching to people. It will probably be tied into the education bit from our side. Legally, or I don't know how to say, you can't stop someone from believing what they want to believe. So in certain instances, some people have been arrested for fraud, for misleading people, and then I don't know, I think taking money or something for which they went to prison. Those ones are within some jurisdictional context. But for getting somebody to, I don't know how I would stop someone from believing, say a priest or a pastor or anybody. But the bit we can do on our side is to still continue on the education bit, enlighten the people, those that are able to reach out to as many people as possible. Sometimes you may need to give a lot of graphics, especially when you are doing presentations. Theoretical knowledge makes it difficult for people to understand certain things. I do a lot of advocacy, and I realize that when you are talking to people and you show them pictures, you show them videos, it helps them to understand what you are telling them better than if you're just telling them, giving them theory, just read. So maybe on that aspect, we can do that while we're educating them, show them pictures of what we are trying to get them to understand, as many people as possible, so that we can be able to erase that bit about misconception about certain health conditions, for them to know that not every hypertension is by a witch, or not every hypertension is from a deity. If you have hypertension, you seek help. You take your medications. If this drug doesn't work for you, we change it. You don't sit in your house and hope that the hypertension will go away. It will go away, yes, but that is with your death. So all that aspects, we may need to continue with the education bits on that side. And then with the cervical cancer vaccination, I don't know which group of people saw the community health workers come in and then were running away because it was an injection. Everybody doesn't like injection. Me, myself, at my age, setting a line for me is a big problem. I have videos on it where I was screaming because it was, and that was even a blue cannula. So nobody likes pain. Let me put it like that. So if little children are running away, maybe it was the community health workers coming to vaccinate them, but if you are able to explain it to them, cervical cancer screen vaccination is by an injection. It's a small dose of the medication you are going to give to them via injection. Maybe later on in life it may come out as tablets or patch or something, I don't know. But for now, it is the injection we are using, and government has started rolling it out, where it's being given to children between 9 and 14. There was an initial rollout, I think about maybe 8 years or 10 years ago or so. That one was targeting both males and females, and that was for central, either one of the upper regions or northern region also. And then there was, I think, I forgot, there were 3 regions that the pilot was done for. Somewhere along the line, I'm sure logistical and maybe financial issues, it died down. But now it's being rolled out again. But the target now is for females between 9 and 14 years. They've started in certain parts of the country. In certain places, I think they pay. In other places, it's not pay. It's free. Kolebu is Ministry of Health, and the other hospitals are Ghana Health Service. We are different wings of the healthcare way, so we do things differently. Sorry. So we can do the bit on our side, and then Ghana Health Service can also do their parts.
Okay. Yes. Any other question? Okay, this way. And then we'll get to our fund, the conversation about our fund next. So, yes.
Hello, my name is Kweku Akwe from the Accra College of Medicine.
Okay.
And mine is more of a suggestion than a question.
Okay.
So, I think when we are doing the education in the communities, I think the leaders should set an example, because I think representation matters. And in every community, no matter how radical you are, when you see your leader doing something, you are more likely to follow and then also agree with what it is. So when we go to our churches and our mosques, and then we are preaching science to where when we work, the leaders should also be there when the screening is taking place. The leaders should follow their citizens to their hospitals, and then their citizens will see them take part in the healthcare screenings, and then they'll be more likely to comply with all the directives given by the healthcare professional. So thank you.
All right. Thank you. And, okay. Let me take you then. We'll go straight to the fund. Yes. Okay.
Hello, my name is Papa Kwame. I'm with Quality Insurance Company. So I just wanted to touch on some of the views that were shared by the panelists. Imam said that there has to be a lot of collaborations. I think that when it comes to the religious leaders, they shouldn't see science as a threat, but they should work hand in hand with it. Why am I saying this? Some of the religious leaders, they see science as something that would end their, or put a stop, or let people rather believe less in the kind of power that they have. Because when it comes to belief, there has to be power for people to believe in you. So I think that there has to be more of the collaborations so that they wouldn't see it as a threat, but like they will work hand in hand for their members. And also, I think Reverend Doctor said something about the fact that some of these pastors are quack pastors, and I don't think so. I think that I witnessed a certain platform of a certain religious leader, and he was stating the fact that this is to support what Imam was saying, that sometimes you need to give money to the people when it comes to these health concerns. So he was using this platform and he was stating that you shouldn't give money to somebody who is poor in the church, because it seems like a curse to you. So this is somebody who has
curse to the person
who is giving the money to the poor person in the church. So I think that this is a religious leader with a very great platform, and he's not somebody who is quack. He's somebody who is a well-known preacher, but he is using his platform in a very wrong way. So I feel that if these religious leaders would open up to more collaboration and not see science as something that will end or truncate people believing in them or believing in the power that they have through their belief also. So I think that this is something that I wanted to share or to add to the panelist discussion as well.
Right.
As well, thank you.
Thank you.
Let me quickly add this, and thank you for that. And picking up from our brother's submission. So in terms of leadership, let me state that now, for some few years now, the Presbyterian Church of Ghana every year mandates all the leaders, so all the clergy and their team, to have their medical screening. We had us just last week. Okay, it's institutionalized. So now you see your pastor going to the hospital, checking his BP, doing his labs, checking his cholesterol, checking his sugar levels, checking his prostate, and if the wife, checking this, checking that. That is a big statement that we've embraced this. And it doesn't say that the priest has less faith. I mean, he's standing there praying for you, doing all night, doing fasting, but he himself has gone to check his BP. It just shows how we are embracing it and acknowledging the wisdom God has given to the science and to the health people, like we've all established here on this platform. So I think the leadership, plays a very important role. And again, for us to know that faith alone without works is dead. You see,
okay.
I believe I'll pass the WASI, and I'm praying for 3 months, and I'm not opening the book. Seriously? Like the apple, it doesn't happen, right? You believe, so you put in the effort and you work at it with all the resources and pray. And together, you see that it will produce the desired effect.
Okay. We've run out of time, so I'll just end my chief on the fund. No? Yes, please. Please give me my microphone for me. And then after that, we will wrap up because we've kind of exceeded the time we... Okay.
So good evening. I'm not a doctor. I'm part of the team that wants to put a fund together, and I'll quickly go through what we intend to do. My background is finance, so we believe that after ripping off people so many years in finance, it's time we give back to society. And so a couple of business executives have come together to create what we call a preventive fund. And the preventive fund, luckily cervical cancer is one of the diseases that will be looked at. So I'll just focus on the points on cervical cancer under the preventive fund. So it's the clear purpose of it is HPV vaccination programs, and we are targeting girls aged 9 to 14. Screening programs, pap smear, VIA, HPV, DNA testing, early detection and referral system, public awareness and education campaign, training of healthcare workers, and community outreach in underserved areas. So this is the purpose of the fund and what we will target to do. The targeted population definition, like I said earlier on, girls aged 9 to 14 years for HPV vaccination. So our target is within 5 years of the fund being set up. Most girls, if not all girls, between 9 to 14 years will get a free vaccination. Women aged 25 to 49 for regular screening. Women in rural and underserved communities, low income or vulnerable population. Then the governance of the fund will set up a 21 board trustee, a medical advisory committee, a financial oversight committee, independent audit arrangement, and a transparent reporting mechanism. Then the sustainability of the fund, we are speaking to corporate social responsibility contributors, philanthropic donations, grants from international health organizations, endowment investment income. This is where we use our financial background to do an endowment investment income and partnership with insurance companies and financial institutions. We believe that for those of us who are involved into health insurance, this fund will reduce our claims outlay eventually. Then partnership with health infrastructure, We intend to do this with district hospitals, teaching hospitals, community health planning and service compounds, and non-governmental organizations working in women's health. Then the screening technology, the options include visual inspection and Arctic acid, low cost and useful, which will be useful in rural settings, pap smear testing and HPV DNA testing. Highly accurate but more expensive. Now, I'll just quickly leave a point that doctor would explain, because our technical people keep on bringing DNA testing in. I'm wondering why DNA testing is vital to, but you may answer that, because this is what our technical people, so if I finish, you may explain why. Then vaccine procurement strategy. So we are well ahead with the vaccine procurement strategy, procurement partnership with vaccine suppliers, cold chain storage and distribution system, integration with national immunization programs, so we're integrating with them, and then negotiations with subsidized vaccine pricing, which is well underway. Then the community awareness and education, we intend to do radio and television awareness, school-based education programs, online like today, what we are doing, church and mosque health outreach. That's why we brought the pastor here and the imam here. The market day screening is big on our agenda. So we select market days and go there and set up screening kiosks and do the market day screening. We've sampled that already around in Sawam, and it's worked pretty well. Then the mobile clinic and rural areas. The monitoring, evaluation, and impact metrics. How we will monitor ourselves and find out whether we've been impactful. The number of girls that we vaccinated in a year, number of women screened annually, early detection rates, reduction in cervical cancer mortality, and geographic coverage of the program. We intend this to have strict financial transparency and accountability. We don't intend to get government involved. We want it to be strictly private and private corporate sector, right? The legal and regulatory structure, we intend to, well, not intend, we are doing a charitable foundation, public-private partnership, and health endowment fund. And the assurance to everyone is that we are aligning this with the national health strategy. Thank you.
Thank you. So, Doc, if you can tell us about the DNA, and then we'll wrap up for the day.
Hello. Yes. So the screening methods we have is the VIA, that's the visual inspection of that acetic acid. Then we have the pap smear. Then we have the HPV DNA testing. What VIA does is to look out for changes in the cervix. We call it acetowhite. So acetic acid, you just dab it on the cervix. Then where there are changes, we go on further to do subsequent tests called a colposcopy. Then with the pap smear, what is done is that is a brush, or sometimes there's a wooden spatula, which is done to take cells of the cervix to put under a microscope to see whether there are changes in the cells of the cervix. And the changes would let you know whether this woman's cervix is beginning to become cancerous or not. But what we are doing with the HPV is that because we are all talking about preventive, screening for it, and then also trying to vaccinate people, what we are looking for in the HPV DNA is the actual HPV virus there, the type that is there. So that if you don't have the one that causes the cervical cancer, which is the 16 and the 18, then you can actively vaccinate yourself. So it's usually done for women over, let's say 25 or 30 years, and it's done every 5 years. It can be done alongside the pap smear, or it can be done alone. Or you can do the pap smear alone. Now it's coming up because when we see the virus, then we can actively work on you, rather than waiting for us to see changes in your cervix. So that's why we are talking about prevention. So let's say we screen and then we do the pap smear or pap plus HPV. The results will come. Pap smear, negative for intraepithelial lesion. That means that there are no changes in your cervix. Then HPV DNA testing. It will say, it will read no HPV DNA seen, or HPV type 16 seen, or 16 and 18 seen, or HPV type 53, 33, whatever seen. So depending on the type that we see, then we know that we should go on further or not. It's essentially for vaccination.
Okay.
Yes, sir.
So, Doc, I mean, for someone like me prepared to invest my money in this, why would I focus on the DNA? Because it's cheaper for me to vaccinate more people, straight up.
No.
It's more expensive, right?
Because if the person already has the HPV virus, then there's no point vaccinating.
Okay.
Yes.
So that's an important point. So basically, if the person has it, then you go straight to cancer treatment.
If the person has
the
it,
19 or whatever.
If the person has it, hello. If the person has it, we go for subsequent tests like a colposcopy, where we are looking closely at the see what. Hello. Yes. So if we do the HPV and we find it there, what we do is to do further tests on the cervix, and we do something we call colposcopy. That's a microscopic examination of the cervix. So we take a very close look at the cervix. We take portions of it to see if there is beginning to grow a cancer in the cervix, for which sometimes we can remove that part that has the cancer and then leave the woman with her uterus, especially if she has fertility wishes.
Okay. So my point is, for those of us who set up the preventive fund, we are not interested in treating the cancer. We're not interested in doing that. All we are interested is check, vaccinate, check, vaccinate, check, vaccinate. And that's why our target is the young girls, so that within a period of time, then you are not going to see the cancer, because a certain critical mass of the population has been vaccinated. Will that work?
Okay, so if you are going to vaccinate young children between 9 and 14, where we assume they are not sexually active, then you may go ahead and vaccinate them straight away. But if you are looking at the older people, then you have to screen before you vaccinate. Because otherwise you're going to end up wasting your vaccine on people who probably may have the HPV infection, and then you still give the vaccine. It's like, whatever, it's like if you don't have a headache and you're taking paracetamol, you're just wasting the medication. So the screening bit, if you want to vaccinate the older population as well, because in other places, people between 25 and 49, if you screen and you want to vaccinate, it's on you. You will decide whether you want to vaccinate or not. But for the younger population, they are being vaccinated. So that's a bit about the two of them.
So my final point is, so between 9 and 14, as we are doing, we can go ahead straight to vaccinate. Between the 25 and 39,
those ones you have
we
to
can
screen
provide
before.
free screening.
Yes,
but
free
then
screening.
if they want to vaccinate, they have to vaccinate themselves.
Yes. So the free screening, you can do PAP plus HPV or PAP, depending on how much money is available.
Yes, because we are strict on preventive. We are not.
Yes.
We do not want to go into cure.
Yes.
All right. Thank you.
And the young population, that's provided they are not sexually active. The 9 to 14.
I mean, you can't guarantee that.
You can't guarantee that.
you can't guarantee
Yes.
that. You only pray that they are not.
Yeah.
9 maybe you can guarantee, but 12, 13, 14 you can't
Would the
guarantee.
questionnaire help?
Oh, who would say
That's
yes?
if they will say the
Who would
truth.
say yes?
You can try.
Okay.
I mean, I think at the end of the day, for me, it goes to our previous topic, as in men should be held
Accountable.
accountable for the spread of this, because even if a 9-year-old is active, he's doing it with a man, and I doubt a 9-year-old boy is that active.
You'd be surprised.
All right, thank you so much for your time, for spending your Sunday afternoon with us, late afternoon to evening with us. And we'd like to thank our panel who helped us with this conversation. From the far end of the panel is Imam Abbas Abdul Karim Umar. He's the civilian deputy imam at the Ghana Police Central Mosque in Cantonment. Imam, thank you very much for your time. Next to Imam is Dr. Mrs. Nita Asamoah Nujima, a specialist obstetrician gynecologist at the Kolibu Teaching Hospital. She's also the host of the Facebook series, Time with Dr. Nita, and she's been with us graciously for all 3 sessions. Thank you so much, Dr. Nita. And to my immediate left is the Reverend Dr. Emmanuel Chirmateng Amwam, the Associate Minister of the Presbyterian Church of Ghana, Parousia Congregation. Thank you so much, Reverend. And thank you all, particularly the students from the Federation of Ghana Medical Students for joining us. And Dr. Susu also has been with us all 3 sessions. Thank you also so much. And thank you everybody, especially those of you watching online as well. Thank you. And we wish you a fruitful week. And we'll be back soon with more announcements on our next set of events. Thank you.
God has done.